Imagine discovering that one of the most talked about parts of the human body is also one of the least understood. For centuries, myths, embarrassment, and misinformation have shaped what people believe about vaginal health. Entire industries have made billions selling products that promise to clean, freshen, detox, or fix something that often isn't broken in the first place. So, what does modern medical science actually say? Today, we're separating fact from fiction. You'll learn how the vagina keeps itself healthy, why many common hygiene products do more harm than good, what every person should know about menstruation, sexual health, infections, aging, and the simple habits that genuinely protect long-term health. By the end of this video, you'll understand why knowledge, not marketing, is the most powerful form of healthcare. For much of history, women's reproductive health wasn't studied with the same seriousness as other areas of medicine. Cultural taboos, limited research, and social stigma meant that scientific knowledge developed slowly. As a result, myths were passed from generation to generation, often treated as facts. Even today, misinformation spreads rapidly through social media, advertisements, and unverified health advice online. Fortunately, modern medical research has dramatically improved our understanding of vaginal health. Evidence, not tradition or marketing, now guides the best medical recommendations. That's why learning the science behind the body is so important. One of the biggest misconceptions starts with terminology. The vagina is only the internal muscular canal that connects the outside of the body to the cervix. The external structures, including the labia, clitoris, and surrounding tissue, are collectively called the vulva. Understanding this difference matters because many products advertise themselves as vaginal products when they're actually meant for external use, or shouldn't be used at all. Knowing basic anatomy makes it much easier to recognize what's normal and when something may need medical attention. The vagina is an incredible self-regulating environment. Helpful bacteria, especially lactobacillus species, produce lactic acid that keeps the vaginal environment slightly acidic. This acidic environment helps prevent harmful bacteria and yeast from growing out of control. Normal vaginal discharge is actually part of this healthy cleaning system. It removes dead cells, carries beneficial bacteria, and helps maintain balance. In other words, discharge isn't automatically a sign of illness. In many cases, it's simply evidence that the body is working exactly as it should. Walk through almost any pharmacy and you'll find shelves full of feminine washes, deodorants, sprays, wipes, and cleansing products. The marketing often suggests that the vagina needs constant cleaning or special treatment. Medical evidence tells a different story. The vagina cleans itself naturally. Using scented soaps, perfumes, or harsh cleansers can disrupt the healthy bacteria that protect against infections. The safest approach is surprisingly simple. Less is usually better. Gentle external washing with water or a mild cleanser if desired is generally enough for everyday hygiene. For decades, douching was promoted as a healthy habit. Today, research shows the opposite. Douching washes away beneficial bacteria, changes the natural acidity of the vagina, and increases the risk of infections. It may also increase the likelihood of certain sexually transmitted infections. Many doctors now agree that routine douching provides no health benefit and may actually make problems worse. Sometimes the healthiest thing you can do is simply allow your body to do what it was designed to do. Sexual arousal is a coordinated process involving blood flow, nerves, muscles, and hormones. One structure deserves particular attention: the clitoris. Although only a small portion is visible externally, most of the clitoris extends inside the body. Its only known biological function is sexual pleasure. Because of this extensive internal structure, pleasurable sensations can come from many different forms of stimulation. Modern research also shows that people experience pleasure differently. Healthy communication, comfort, consent, and understanding one's own body are often far more important than myths about what should happen during sex. Every menstrual cycle is carefully coordinated by hormones released from the brain and ovaries. The uterus builds a nutrient-rich lining in preparation for pregnancy. If pregnancy doesn't occur, hormone levels change, and that lining sheds. That's menstruation. Every cycle is slightly different. Flow, duration, color, and symptoms vary from person to person. Pads, tampons, menstrual cups, discs, and period underwear are all reasonable options. The best menstrual product is the one that's safe, comfortable, and fits your lifestyle. Pregnancy causes enormous changes throughout the reproductive system. Blood flow increases, hormones shift dramatically, the vagina becomes more elastic in preparation for childbirth. After delivery, soreness, swelling, bruising, and temporary discomfort are completely normal parts of recovery. Healing takes time. Most people gradually recover over several weeks, although everyone's experience is different. Understanding these normal changes helps reduce unnecessary fear and anxiety during an already challenging time. Menopause marks another major transition. As estrogen levels decline, vaginal tissues may become thinner, drier, and less elastic. Some people experience irritation or discomfort during sex. Others notice very few changes. Modern medicine offers several effective treatments, including moisturizers, lubricants, and hormone therapies when appropriate. Menopause is not a disease. It's a natural stage of life that can often be managed successfully. Sexually transmitted infections are incredibly common. Many cause no symptoms at first. That's why regular screening is so important, especially for sexually active individuals with changing risk factors. Vaccination against HPV has dramatically reduced the risk of cervical cancer and other HPV-related diseases. Condoms remain one of the most effective tools for reducing STI transmission. The key isn't fear, it's prevention, testing, and early treatment. Itching, unusual discharge, burning, and irritation can have many causes. Two of the most common are yeast infections and bacterial vaginosis. Although their symptoms can look similar, they require different treatments. That's why self-diagnosis isn't always reliable. Evidence-based medications work far better than most internet home remedies. When symptoms persist or recur, professional evaluation is the safest choice. The internet is full of dramatic health claims, detox products, miracle cleanses, natural cures, secret remedies. Many sound convincing because they're wrapped in scientific language. But words like natural, pure, or detoxifying don't automatically mean something is safe or effective. Reliable medical advice comes from evidence gathered through careful research, not viral trends. Learning how to evaluate health information is one of the most valuable skills anyone can develop. Every body changes over time, but certain symptoms deserve medical evaluation. Persistent pain, severe itching, unusual bleeding, strong odors, new lumps, pain during sex, abnormal discharge. When talking with your healthcare provider, describe symptoms as specifically as possible. Small details often make diagnosis faster and more accurate. Fortunately, maintaining vaginal health doesn't require expensive products. Simple habits make the biggest difference. Practice safer sex. Attend regular health screenings. Avoid unnecessary internal cleansing. Eat a balanced diet. Don't smoke. Seek medical care when symptoms appear. And perhaps most importantly, don't let shame prevent you from asking questions about your own health. Knowledge leads to confidence, and confidence leads to better decisions. Modern medicine has transformed what we know about reproductive health. Many old myths have been replaced by decades of scientific research. The biggest takeaway is surprisingly simple. The vagina is remarkably resilient. It usually doesn't need expensive products, complicated routines, or miracle treatments. What it does need is informed care, evidence-based medicine, and regular attention when something feels wrong. Understanding your own body is one of the best investments you can make in your lifelong health. If you found this video informative, remember to like, share, and leave a comment with the biggest myth you've heard about vaginal health. And if you don't subscribe to the channel now, there's a good chance you won't find us again the next time you need trustworthy book summaries and science-backed insights. Thanks for watching, and we'll see you in the next video.